Hello, I'm Dr. Gwynn Patterson, board certified OBGYN doctor, and I also do aesthetics. Welcome to my practice. Many of you already know me. I'm using this time to discuss with you my aesthetics practice because often during the course of the OB or gynecology appointment, questions arise, but we don't have much time to discuss it. I have treated skin problems all my life, starting with acne. People come to me for their acne, and I treat them with birth control pills to suppress hormonal stimulation. I never had a complete list of products to help patients with whatever their skin problem was. I would treat them with medications that are FDA approved, but never treated the skin itself. PCA is a company in Scottsdale, Arizona. So it's owned by a dermatologist, very big practice, and everything they use is plant-based, it's non-toxic, and it's proven in the dermatological literature to help your skin. It's not one size fits all, and it's not cosmetics. It's true skin therapy. If a patient is not really sure what she should be using on her skin and doesn't want to spend a lot of money for products that she's never going to use, I recommend trying the trial kit. The trial kit's going to last about 4 weeks. It gives you the opportunity to try certain products out, and then you can buy the full size, which of course would be more affordable. After using the product for 2 weeks, I recommend a peel. Understand that a peel is not a facial, but it's true skin therapy. Toxins are taken off and your skin is infused with antioxidants, correctives, and protection. The peels that I do are intentionally not inflammatory. I don't want you to be peeling or having side effects such as peeling. Peeling is a side effect. To get the result that you want, you don't have to peel. If you do peel, it's nothing terrible, but my point is there's very minimal downtime. Aging is a process that's identifiable, predictable, and correctable. Most of the aging process is not skin laxity. And by that I mean it's not that you need to pull that skin up and sew it tighter and firmer. It's actually loss of volume. As we age, we lose bone, we lose muscle, and we lose collagen. Because of that, there is deflation. And deflation leads to descent, and descent leads to distortion. I like to correct aging with a complete holistic view with foundation, correcting the volume loss, contour, and then refinement. This 3-stage process has given me amazing results. I believe I'm the only physician in this area that's using cannulas and biostimulants such as Bellafill and Sculptra. I've taken special training and I'm well versed in these products, how they're to be used, and what the risks, complication, and benefits are. I would love to show you the 3D pictures of your face. My staff will take those pictures and show you if you're interested. The beauty of this process is that it's non-surgical. There's no cutting and sutures and virtually no downtime. It's hard to answer what the best injectable is. I think you have to look at injectables as temporary and then biostimulants that are more permanent and long-lasting. And different injectables are used in different areas. No, there's not a lot of difference between Botox and Dysport. Really, Botox was the first to get FDA approval. Dysport is about the same science. They're both FDA. They are neuromuscular blockades. We use them in areas on the face where we want to paralyze obnoxious muscles that make us look not so good, especially the brow. And the wonderful thing about Botox and Dysport on the brow is that it has a paradoxical effect to raise the brow. IPL stands for intensive pulse light. It's done with crystals that tailor the light to certain pigments, and that's how we use it. It treats the pigments in the face, the dark spots, like no other therapy. Can also treat the spider veins in the face. It takes the browns and the reds out that have accumulated there over years from sun damage. It's just an amazing therapy, not just for the face, but the neck and décolleté. It also treats acne. I mean, it will get acne under control just like that because it kills the bacteria. No, it doesn't take any time at all because the light energy is doing all the work. So once the face or the skin's hit with that light, done. It's not surgical. And you will actually be seeing the results of that IPL 4-6 weeks later as the body clears those pigments off your face. A laser is collimated light, so it's different than an IPL and therefore more focused, stronger. It can be used for taking tattoos off. I have a great laser for that, state of the art. But also it can treat pigments that are on the face that other modalities will not work. For instance, patients with melasma cannot use the IPL, but they can use a 1064 laser. Hair removal is really a cinch with an IPL. It takes about 6 treatments because the hair follicle has to be treated when it's in the growth phase. And only 20% of the follicles at any given time are in the growth phase. It is only going to treat hair that is dark. It will not treat gray hair or white hair. Yes, there are going to be times when the peel or the laser leaves you with blemishes, spots. So we recommend Oxygenics. It's a cover-up. It's like a skin. You pat it on. It's matched to your skin type completely, and it can be used as a foundation. It's pretty awesome. They use it in Hollywood on stage. It was designed for that, and makeup artists found it. It's fantastic. If for whatever reason, after a peel or an IPL, you feel a little blotchy or you have a little blemish, get this product. Well, it's amazing.